So I wanted to discuss this amazing case that I did, which was actually featured on ITV's Olivia Attwood's Price of Perfection. And I want to break this case down. So this patient came to see me because he was really unhappy with his overall smile. He in particular did not like the gaps present between his teeth, the uneven smile that he had, and of course the colours and discoloration that he had between his teeth. Now, this chap never really explored the option of cosmetic dentistry. And when he came to see me, I went through all the different options with him. And we realized that actually this was not a simple case of just simply whitening the teeth. We really needed to realign the teeth to make sure that he had a correct alignment and correct bite. And following that, we could then do some whitening and then maybe do some composite. So the first thing we did is we planned a treatment of clear aligners, and this meant that we could first align the concerns that he had and move the teeth into a better position. So this is the teeth beforehand, and we can see that he's got a little gap on this left-hand side, and we first did some alignment. So this was the teeth after we realigned them. So we can see here that the teeth are now in a better position. Although the teeth themselves are slightly discolored, we can now see the overall tooth position is much better. And we still have this slight height discrepancy here, and we still have some chips on the edges of these teeth that you can see, and he's got some generic tooth wear on the bottom, and this is mainly due to attritional tooth wear. That's edge-to-edge wear of the teeth. So what we decided to do is we wanted to then do a little bit of teeth whitening. So we can see here now he's now whitened his teeth. The overall appearance of the teeth looks much better, much brighter, but we still have this concern, slight wear and tear of the tooth position. What we really want to achieve is a more symmetrical smile. So we want the smile to really follow the lower lip curvature, and we want to make sure that the edge position of the teeth, you can see here, is slightly longer than this position here. So we want to correct that as well. We can see when we really zoom into the image, we can see this sort of characteristic attritional wear on this teeth here, and the overall tooth has been lost due to tooth wear. And we can see that on the other side as well. So when we're looking at restoring the teeth, we're looking at actually improving and restoring what was there, what nature gave you. We decided upon, after whitening, to do some composite bonding to help improve the overall look. Composite was chosen as opposed to ceramic veneers due to the age of the patient, due to the fact that the teeth were relatively healthy. You can see there's very little restoration of these existing teeth anyway. And of course, composite is a very minimally invasive approach for this patient because they were young, because they had minimal restorations in the past. Composite was the most appropriate option. Following this treatment, what we decided to do is the composite bonding, and now we can see composite has been placed on the teeth. What we can see that we have used a slightly lighter tooth color. This was a patient's preference. We trialed a number of different colors, and what we end up going for is something slightly brighter. The patient wanted a bit more of a vibrant look, a wider smile, and we can see now the lower lip is now coincident with the upper teeth position, the incisal edge position. We can see now we have got a really nice filled out buccal corridor on these sides. So now we're showing around 10 teeth on smiling, whereas previously we were showing a little bit less than that. In addition to that, we've got lovely convergence of teeth. So whenever we're looking at smile design, we're looking at how the teeth come in, and we're looking at the shape. We're looking at the way that the light affects the tooth. We can see here, everything is coming into the navel, and that's what we want when we're planning our smile. So we've got an increased and improved smile height curvature which fits the lower lip. We've got improvements to the tapering of the teeth. We've got the filling out of these buccal corridors. In addition to that, we've got improved tooth color and restoring the tooth wear. So the overall result is fantastic, and the patient was really delighted. We can see here from the side as well, we've got a lovely smile profile. This is the patient's beforehand. This is the patient's gleaming smile. This is one for the records. Obviously, this was documented on ITV. Please check it out if you haven't already seen it.